EKG Interpretation Part 2. Let's tackle this question. The nurse is caring for a client after mitral valve replacement surgery. The nurse walks into the patient's room and notes this rhythm on the monitor. Which of the following actions should the nurse prioritize? Now, if you recognize this rhythm, I want you to let me know in the comments. If you do not recognize this rhythm, then let's break it down. So we ask ourselves, do we see a P wave? No, I do not see a P wave in this rhythm. Do I see QRS complexes? Yes, I do see multiple QRS complexes, and they are not wide, they are regular. Are my R to R intervals equal? Yes, they are. Now, let's calculate the heart rate. If you count the QRS complexes, you're going to have more than 150 beats per minute. So based on our questions and the answers, I know that this rhythm is supraventricular tachycardia, or SVT. Let's break down the word. Supra means superior, so above. Ventricular, so we have above the ventricles, tachycardia. So in this rhythm, we have an electrical stimulation that is causing this tachycardia that's coming from above the ventricles. So that's why we have this uniform regular QRS complex. Now, finally, let's look at the answer choices. So which of the following actions should the nurse prioritize? What are we prioritizing? Option 1, prepare for cardioversion with synchronized shock. Okay, we can do that in SVT. Option 2, prepare adenosine at bedside to convert to normal sinus rhythm. Okay, I know that adenosine is used for SVT to convert to normal sinus. I'm going to leave that option available. Option 3, ask the client to bear down as if they're having a bowel movement. Maybe I want to stimulate the vasovagal. Option 4, educate the patient that this is a common result after mitral valve surgery and his heart rate should start to lower soon. Not a priority. So now I've narrowed it down to options 1 through 3. That's still a lot of options, but when I'm thinking of interventions for a nurse and what I need to prioritize, I'm thinking least invasive to most invasive. And of these 3 options, which is least invasive? Option 3, and that's our answer. We ask the client to bear down as if they're having a bowel movement. We stimulate vasovagal so that we can lower the heart rate. All right, and follow for more. I will be posting more basic EKG interpretation videos. Next, we're going to dive into how we can differentiate our atrial and ventricular arrhythmias.